doesn't want to stay home? Everybody wants to be at home. I know I'm going to want to be home. You know, and people who have to leave their home to go into assisted living or nursing homes miss their homes. So, of course, the first recommendation that we make would be for home care, in-home care.
I've always utilized you know, home care agencies. That's a very important and companion agencies component of helping people who all of a sudden have trouble living independently to provide support in the house. Most people do prefer, as they age, to remain at home because simply that's where they're familiar with. People fear a change. Many people are private, they like their privacy, and they don't know how they're going to interact in a social environment.
I think if they're spending too much time watching television, spending too much time alone, sometimes they may feel, or the family may feel that they're isolated and not able to get out on their own. And I think that would be an indication that they might need companion care.
As long as the person wants to remain at home and they do need support, then obviously the only way to accomplish that is to either have a companion or an aide in the house.
Well, the companion care is non-medical care. It's not hands-on care. It's more of a homemaker, housekeeping, supervision type of care.
Meal preparation, running errands, offering social interaction.
Shopping and cooking and meal preparation and cleaning.
So companions can often offer cues and reminders to the person when to take their medications and when to do some other tasks. And also an important thing for a companion is that they're there for safety monitoring. Often a person, especially with cognitive loss, is not safe to be alone. So a companion can offer just somebody in the house to make sure that everything is okay.
Taking the client out on trips, taking them shopping, taking the client to the library, taking the client to the doctors.
Often something which is very valuable for companion agencies is the driving aspect. Especially here on Long Island, many people need someone who's able to drive them outside the house, and generally licensed home care agencies don't allow their aides to do that, whereas a companion agency often does allow their aides to do that. When you're hiring a home care agency, you want to make sure that it's a reputable agency that's been around for a number of years. You want to make sure that the agency is one that is the employer of the worker who comes out, who does proper payroll withholding, who has a workers' compensation and disability for the workers, and maintains an ongoing involvement with the case.
I like to use companies that I'm familiar with, that I've used in the past. I think a personal recommendation is good. If they're insured and bonded, that's a good thing. I like to be able to work with the coordinator, like Susan, who can almost anticipate my needs, and that's very important to me. And obviously, you know, we want caring, attentive companions.
You definitely want the agency to be receptive if, for instance, the family calls up and says this just isn't working, the personalities aren't working with the companion whom we have. The agency should be very receptive to try to find a replacement which would be better. And that's an important quality you want in any agency which the consumer uses.
How long they've been in business, if they can make you know, if they have people who would recommend them, I would speak to other people about the reputation of the company.
When looking for a companion care company, I think the best thing would be, first of all, to ask for references and to follow up and really make the calls. And you can tell a lot from the reaction that you get when you speak to references. You also want to see how long that company has been practicing. Often a long period of time is certainly evidence that they're well received in the community and they're successful. Obviously, you need to ask what your fees are, and you want to compare one with the other. And you get a general sense, even speaking with the people on the phone, how they react to you, how they answer your questions, and those type of things.
I've worked with home companions for about 10 years or more, a very long time, and I find that they are very responsive to my needs and to the needs of the families that I work with, and that's very important to me. They have a very good coordinator in Susan, and they can provide someone very quickly, which is sometimes very important to me. And the people that they provide are generally excellent.
For any family who's contacting an agency to obtain someone in the house, either for themselves or for a family member, it's very important to be able to speak with the intake person to describe what they're looking for in an aide, and what, and sort of the more they can explain what the person's needs are and personality, the more the agency will be able to match the right type of companion with the person receiving care. And of course, when you do contact a companion agency, you want the intake person to be receptive to that, and to try to tailor the person that they're going to send into the house for the best needs of the person receiving care.
I think it's all personality. It's very difficult, I think, for a companion just walking into a home. And what I tell the families that I work with is that you have to sit down with the companion and you have to tell the companion what you would like her to do. The routines that the person has, what they like to eat, where things are in the house. I think it's important, because I think it's very difficult for someone just walking in cold, and families sometimes expect that person to just know everything automatically. So when I work with families, I tell them that that's very important. And you have to assess whether the two people are a match, whether the companion can establish a rapport with the client, who very often may have dementia or Alzheimer's disease. And so a companion that's sensitive to that issue is very important, I think.